All right. This is Elsie Kearns, and I would like to welcome everyone to our webinar tonight. We are going to be speaking with Dr. Gail Van Kanegan, who is in Rochester, Minnesota. And Gail is an advanced Eden Energy Medicine practitioner, a board certified family nurse practitioner, and she has many other credentials. She's teaching nurses, and she's integrating all of the energy medicine from the many modalities that she has studied over the years. So I want to welcome Gail and ask her to introduce herself a little bit more. And I first want to begin, Gail, by asking you about your journey.
Thank you. Hello, Elsie, and hello, everyone who's out there. And I would just like to say a hello to my sister, Glory, who is joining us. And I'm delighted that my family's supporting me and they want to learn more about energy. My journey began many years ago with my own self-healing, as many of us take that as our route to getting into working with the energies. I had a lot of stress and a lot of indecisions and was in a lot of dire straits, and I thought I could just go get a massage. So I went to my massage therapist and she said, Gail, you need Reiki. I can't help you. So she shifted me over into her partner's office and started doing Reiki work on me. And that was the beginning of my experience with healing with the energies. And by the profound nature of how I healed from that experience, I knew that I needed to work with them a lot more. And I've been a nurse since 1982 and always led people towards holistic ways of healing, but didn't truly get to experience it as it was pretty limited where I was living at the time. So I started to refer more people to Reiki, and I got more interested in it. And then the opportunity came up, and I was able to become certified as a Reiki master. And I went right on into Eden Energy Medicine from that. I got certified as a practitioner for Eden Energy Medicine in 2010, I believe, maybe 9. And then I also taught with Laurel Camden, who was my teacher, down in St. Louis for a year. I helped her with her classes, and that was invaluable experience. And then I went right on into year 3 and year 4 and became an advanced practitioner. And while I was doing that, I was doing my doctoral studies at Augsburg College to get my Doctor of Nursing Practice. And so I have that. And then I stepped right on into doing energy work for a whole year, and then became faculty member at Augsburg College. And I teach the DNP, the Doctor of Nursing Practice, family nurse practitioner students. And our program is unique in that it's holistic, transcultural, and we focus on teaching the integrative aspects of healthcare in addition to the traditional medical cares that we have to care for people as a nurse practitioner. So we are only one of 3 schools in the whole nation who integrate wholeness, wellness, and energetic healing into infuse it right into their nurse practitioner program. So I'm very proud to say we've done it for over a year now, and it's been very successful in bringing the energies to the nurse as they are developing their primary care experiences, so they can take that forward. And when a patient comes into the office, it's not going to be, here's a pill, here's a pill. It's going to be, let's look at this and see what we need and what other things can we use besides just jumping to a tablet, and giving people accountability to care for themselves and finding non-financially hardship producing ways of caring for themselves and self-care with integrative, holistic, and energetic ways. So that's kind of where I've sum it up really quick of all the great things that I've been doing. And I teach foundations myself. In fact, I teach this weekend for the fourth class for this year. So my students are graduating on to year 2 after next weekend. I'm very proud of them. So I enjoy teaching energy medicine, and I have my own private practice of energy medicine also. A little multifaceted going on.
So, Gail, I just want to say I have one comment from Carol that there's some echoing. So I'm going to ask Carol to be a little more specific. And can you maybe turn down your microphone a little bit? That might help. Now, I want to comment here about your private practice because I want people to know that you also do fabulous distant healing. I have experienced that with you and found it very effective, very effective. And I'd also like you to just go back. Thanks, Carol. She just let us know that she reset a couple of things and everything is working fine. So thanks, Carol. But I'd like to go back and ask you to just tell us how you first met Donna and what that experience was like, because everybody talks about the wow of meeting Donna Eden.
I first met Donna Eden when I went to year 2 in the certification program. And at the time, Donna was teaching a fair number of classes. I was very fortunate that she was still very active in the teaching of the certification program. And she came on stage. Actually, her aura lit up the room before she even entered it. It's incredible, the energy that she has, and her radiance and her radiant circuits that just glow and send and emit this beautiful, joyful, spiritual, peaceful, and exciting energy all at the same time. And it makes everybody just dump any kind of stress that they're feeling and start to feel good. She lights everybody up. She's so genuine and authentic, and the most knowledgeable woman I've probably ever met. With all the millions of people that Donna meets, and I know she's met thousands and thousands and thousands of people. Every month she meets thousands of people. She's never forgotten who you are. She meets you once and she knows who you are the next time. And it's not about the name as much as it is she knows your energy. And you connect immediately with her on that energetic level, and you start talking, and it was like you've been best friends forever. It's wonderful to be around her, and then to just hear her wisdom, and to take in all the pearls that she has to offer about self-care, about helping someone else, and what the little tiny nuances in the movement of energy mean really big things. And she also instills in you that you don't have to be a superpower. You don't need to have this ability to see energy or even feel it to be able to work with your own body energies or with anyone else's energies. And that's the brilliance of what she's done, to take this method of healing forward. So everyone can do it. You can teach anyone how to do Eden energy medicine, and there will always be a positive effect. And I've taught 3-year-olds how to do it. My grandson, for one, and his experience was so profound, I wrote a story about it, and I submitted it during our class and for our CP, and they liked it so much they published it and gave me an award for writing the story about how my grandson used energy medicine to help me heal one of my friends, and he was only 3. So there's no limit to what you can do with energy.
Well, I would agree with that. And I have to say that the very first time that I saw Donna on stage, I said, I don't know what that is up there, but I want that. And I began following her, as did, everyone else in the world.
It's remarkable because it's feeling good is contagious, and it's a beautiful way to feel. And when you know you can have that, because she shares it and she teaches it and instills in you that it's yours too. You just have to do it.
Yeah. Now, Gail, one of the important questions that I want to bring up early is that people have asked, what would be your advice if you're trying to introduce energy medicine, whether it's Eden energy medicine, Reiki, whatever that is, into the traditional medical system? Um, we have a PowerPoint slideshow, and we're going to talk about the book that you did, but just in general, what advice would you give practitioners on that approach?
It is difficult to put our five-pointed star of energy into a cube. And then the world that I work in the medical world, is a cube. And it has the four sides around it, and it's difficult to get things in or out of that box. And we know energy is dynamic, and so I refer to the five-pointed star as the energy, and you can't just insert that in there. So you have to, number one, know where the box lies, and then you need to recognize who are the people who are going to support you in your endeavors. And making yourself known for your talents and your skills in working with the energies in the holistic part of this. It's about holistic care for the patient. It's not about focusing on doing treatments on someone, but it's about giving the patient the choices to have as much holistic care all the time as a choice, rather than just getting that pill thrown at them. I connected with the Holistic Nurses Association, and I connected with the nurses in the hospital who were holistic and working on projects pushing forward holistic care. I got on some committees, and I got myself known, and I let them know what I was doing, and I had seminars, and I would go to the different units. I went to almost every unit at Mayo Clinic, to the nurses department meetings, to talk to them about energy work and holistic nursing care. And I've given them all little pearls, and I keep going back and doing that. So you develop your following by sharing your knowledge and empowering others to have that as well. And then you just do what you're supposed to do. And when somebody needs something done differently, for instance, say someone has a really bad headache and they're wanting to get their IV push drugs, and this was an actual case where I walked into a room to see a patient, and they were there wanting to get the IV drugs because they were having this bad migraine headache. And all of us know that narcotics are not the way of treating headaches. It's totally inappropriate, but what it does is it makes the person not feel the headache, but it doesn't make it go away. So I stopped the drug from getting into her system, and I asked her, I said, how would you like to try something a little more holistic, and something that you would be able to do for yourself to rid yourself of these headaches and not have to be in the hospital taking drugs and getting dependent on them to get rid of this problem? So she agreed, and so I held her neurovasculars, which was hand on the forehead and hand on the back of the head, and holding it just very lightly. And when I started, her headache was, as she called it, a 12 out of 10. So I asked her about every couple of minutes where the headache was at, and it took about 5 minutes to connect her neurovasculars so I could feel the flow of energy going through my hands and through her brain. And the headache started to reduce. And every few minutes thereafter, I asked her again, how's the headache? And it went from the 12 down to a 10 to an 8. Then it went to a 3. And then all of a sudden it was completely gone. And it took about 12 minutes for that to happen. Mm-hmm. And this was a person who had long-standing terrible migraine headaches and had long-standing narcotic use for it. So she's also getting headaches from narcotic withdrawal in addition to the migraines.
Oh,
And working with that, it was also witnessed by a physician who was totally amazed that I could do that. So I explained to the patient it wasn't me, but it was the connections. And I taught her how to do her own connections. And she's never been back for narcotics for headaches. Her headaches don't come back anymore. And she's doing her own maintenance on that now. So it's that simple that this keeps you out of the hospital. How wonderful is that?
would you show us your little actual neurovascular lady that you
Sure.
have here? You said you had to credit Laurel Camden for this.
Yes.
So it was so great.
This idea of this my little buddy Styrofoam Head came from Laurel Camden, who was my instructor and who is my mentor yet. And she's an instructor with Eden Energy Medicine. But the head, we used it to learn how to mark where the neurovascular points were at on the head, because there's many of them. And the neurovascular points are areas where the nervous system and the blood vessel system join together, and they're a stimulated point. And when you touch them, the blood starts going through the brain at those areas, and it innervates the brain and restores blood flow through there. And headaches go away, pain goes away, many things change. You stop being depressed, your moods change. So I wanted to use her here today because I learned some new headache points, which I wanted to share with you.
Great.
And so I mapped out where these are located on the meridians and such. And you hold in the front of the head and in the back. And you see the red dot in the center down here. This is the power point, okay, right in the center of the neck. And this is right behind the ear, at the electric point, actually. Okay, and then this goes up a little bit higher and then up a little higher, and this is the kidney neurovascular point. And this one is I don't know. I never found what this was associated with, but I know gallbladder runs through there, even though it's red. But I marked it red because pain is red to me, so I just made that one red. And then in the front of the head, we have the bladder meridian that you're holding, and you have your main neurovascular point, and then you have gallbladder. So we're working with some really big powerhouse meridians here and stimulating acupressure points to stop the pain. So the way this works is you start at the blue dot, which is the bladder meridian, and you go to the kidney in the back. And you hold these 2 points until you get pulsations, and you can feel the energy going through, and it usually takes about a minute or so. And then when that's done, then you move over to the next point in the front and up to the next point, which is back right by it's between the electrics and the kidney. And you hold those 2 points until the pulse comes through to the fingers and you feel it. And then you go to the gallbladder point on the forehead, and you go to the where am I at here? Here. And then you go to the electric point.
Mm-hmm. Oh,
So
okay.
you just follow. You start at the middle, in the middle, and you go to the side, and next to the middle, and then the side ones. Then, and you follow that meridian. So start in the center and just work your way out. And by the time you get to here, there's no headache anymore, and you've restored incredible amount of energy to the brain. And you can do this on one side if they have headache on one side, or you can treat both sides if it's a global headache, and do the same thing on both sides of the head. I only marked one so it wouldn't get confusing with too many dots. So you can just do it to the other side of the head as well and get those other meridians over here. the bladder, the main neurovascular and the gallbladder. And
Okay, yeah.
so
Well,
that's
I love your doll because she's very glamorous compared to the ones I've seen. So I'm going to try to bring over this PowerPoint and bring in a couple of things because you also have that great book that you did. So I can see the PowerPoint. How about you?
I see it.
Okay. And so, of course, this is the first slide showing us together. And we've seen this slide before, but I just want to reiterate Albert Einstein, his famous line, energy is all there is. And of course, here's Donna. This is my favorite picture of Donna doing the cross crawl. And the other picture is from the San Diego conference. But one of the things that I want to stress to everyone in Eden Energy Medicine is that you are in the Eden Energy Medicine grid. So you're part of that grid, and there's a whole set of guides and spiritual help. It's a magical grid, just like our leader, Donna Eden. So you need to call on that grid to help you. And we're going to talk more about the PowerPoint when we come back, because I want you to show us a couple of other things, Gail. But I just want everybody to see exactly where that is, because any connection from the PowerPoint to anywhere on the body is extremely nourishing because it's directly linked to the brainstem, the hypothalamus, and the grid. And here's a picture of the front of your book. I'm going to have you talk about that in a minute. Triple warmer, avoiding the stress response. This was something that you created for the medical team that you're in. And I love this picture. Just beat it, fight off the stress, be the one in control. I love that. And I want everybody to know that you're going to get a PDF of the PowerPoint slideshow. So you'll have all this information on how to obtain a copy of Gail's book, The Triple Warmer, Avoiding the Stress Response, that she really designed for her medical colleagues.
Yes, yes.
So they'll have all that information on the replay. And these are all the things that Gail does, all the things that certifications and all of the areas that Gail works in to help people holistically. And this is just a reminder that, as you give, you receive. And to remember that you are part of that Eden Energy Medicine grid. And Donna has just graduated another second year class. The world needs us more than ever right now. So I encourage you to hold yourself, all those graduates and all of us, in love, honor, and reverence, just as you are in the moment. And remember, the body is always the healer. You are the facilitator through the divine hands of God. So you'll also have on the PDF that I send you all of this information about Gail and myself, all the information about the rest of the classes and how you can reach Gail or myself. And I just want to mention that we're going to have Jeff White back in February, and he's going to be actually demoing some energy medicine techniques and talking about the fact that we're going to begin a Foundations Year 1 program here in Cherry Hill this spring. So we're kind of excited about that. So I'm going to put that off and come back to you. So Gail, tell us a little bit more about what prompted you to do that little stress response, talking about triple warmer, which we've learned in Eden Energy Medicine, but bringing it down to a level that, you know, as you said, everybody can hear it.
Yes. You know, being a nurse, I'm always looking at what makes people sick. And the bottom line is everything that makes someone ill, causes chronic illnesses, even acute illnesses, is a result of stress. And we don't know how to manage our stress. Half the time we don't even know we're in stress when we're in it because we're so caught up in it we can't even tell that we're being stressed. But the harmful effects of it have been described for many, many, many years in a physiological way, about the adaptive stress response that we all have, and how stress is important to have a response to get us to do things we're supposed to do. However, it needs to stop and then go back to normal function in our bodies. Otherwise, we get into a chronic pattern of stress response, and then all of our inner organs start becoming overproductive with all of the things that were helping us to begin with, such as adrenaline and epinephrine or norepinephrine. Blood sugar elevations will stick around and stay high with a chronic stress response. The liver produces more blood sugar also, which is harmful for us. Our steroids get produced even at higher levels in a chronic stress response. And all of these hormones that are being released cause the cells to stay in a terrible state of irritation, and then they release their histamines and all their chemicals that cause more irritation. And so each cell is reacting, and the next thing you know, you've got a chronic illness that's developing. Maybe someone is developing heart disease as a result of this. And this has been well documented that heart disease is a result of stress, and many other things. So every disease that I look at, I can see that stress is the basis of all of it. So I've been working hard to help people reduce their stress. And all my doctorate work was done in stress reduction and reducing the effects of chronic illness. And I was fortunate enough to heal myself from a chronic illness when I started into energy medicine. So I knew that it worked because I no longer have asthma, and I had it very badly before. And I reach for my Meridian to flush it now instead of my inhaler. And I'm healthy and there's nothing wrong with me anymore. So this is how I focused my work. It became my passion because I knew if it could heal me, it can heal other people. So I'm always working towards stress reduction. And how do you get someone to do that? And Donna and Eden Energy Medicine has taught me many, many ways to reduce stress. And I thought, I'm just going to start giving people little exercises to do. Just do this one little thing, do this one little thing. And then it turned out I had a whole, composite of 4 or 5 pages I wanted to give someone of little exercises. And I thought, that's not realistic. How can they carry around pages of things? So I just decided I'm going to make a little booklet and make it user-friendly and something that they can stick in their pocket and use it whenever they want as a reminder until they get into the habit of doing these exercises on a regular basis and recognizing when they're stressed. So I created this tiny little book. And it is little. You see, it's just,
Yeah.
2 inches big. It fits right into a pocket, and it's laminated very nicely so you don't get it tore up when you throw it in your purse, or you stuff it in your coat pocket, or you've got it in your lab coat pocket, or you put it in your energy bag of things, or you throw it in the diaper bag or whatever bag you're carrying around. So it'll hold up to the abuse, because I started out with just paper copies and that didn't work for very long. So I made it into laminated, and it's quick and easy. And it has a little introduction about tips for avoiding stress and what it all means, and about what triple warmer is about and how the role that he plays in our stress response. And the good news of being that we can avoid the stress response by calming triple warmer. And a little picture of some meridians, because no one really knows outside of people who work with energy what meridians are, and they're very important. And we connect with them during our stress reduction exercises. And then I just go into little tips for avoiding stress, and I talk about tracing triple warmer backwards, which is just so simple. You just trace right down and off. And you can all join me with this. You start at the temple and you go behind the ear and down your shoulder and then right off the back of your hand, off that ring finger. And that calms triple warmer. And most people start doing this because we're always constantly putting our hair behind our ears. And this is really a response of our body saying, calm me, calm me. So we do it. The hair gets pushed back there as a secondary thing, but consciously we think we're pushing our hair back, but our body's saying, calm me. So we're calming triple warmer while we're doing that. So that's right on there. Then I have and there are specific instructions how to do this, so anybody can do it. Tracing spleen meridian forward, starting at your big toe and coming up the body and up to the armpits and then down to the bottom of the ribs and giving it a little thump down there and get it going. The one I like the best to teach people is the triple warmer spleen hug, because it's so simple to do. And I'm going to just move about here so you can see. But when we stand and we cross our arms like this, and I always ask people, what kind of positive energetic result do you get from this? And no one can give me a reason. And I'm like, okay, so there's no reason to do that anymore. So why don't we do this and benefit your body to reduce the stress and strengthen your immune system? So I show them one hand to the back of the left elbow and the other hand over the liver. And hold your arms in this way instead of crossing them over, because now you're taking energy out of triple warmer and you're nourishing your liver, which is part of your immune system. So hold it that way and then switch. Other hand back here, the other hand right on top of the spleen. And then hold your arms that way. So when I cross my arms, this is what I do. So I'm always calming triple warmer and feeding my immune system to avoid any kind of chronic illnesses and colds and viruses, staying strong. So that little tip is in here. Talk about neurovascular holds we did before, and I put this in here because stress it really kicks in triple warmer and it takes away from our immune system. And when we're stressed, we can't function and we can't even think. So this is a real quick way to get out of stress, and just tells them hold lightly and 4 or 5 minutes. Then I have grounding exercises, because if we're not grounded, we can't stay out of stress. So really emphasize the importance of being grounded and hooking up, middle finger to the forehead and the other middle finger to the navel, and connecting those energies so that you've got the top and the bottom half connecting in through the aura and grounding you, releasing the stress, the tension, just really revitalizing your radiant circuits even. And then let's see, I've got a couple more. Way to keep negativity out of the aura with doing the thumps, the 4 thumps, and keeping that nice and strong and zipping up that aura so you keep all that negativity out there where it belongs and not in on you. And then to restore radiance, tracing figure 8s through the aura, through everywhere you can think of. Just do figure 8s constantly. I walk down the hall doing this all the time. and everybody's used to seeing me do it, and they love it because it helps them also. And then we have 9 hearts, which is another radiant circuit exercise that it calms triple warmer and it connects all those radiant things, and you just start feeling really happy and good. And you just place your hands on your forehead and you just trace a heart around your face 3 times. And then you do it over the trunk of your body 3 times. You start at the heart and work your way down to the waist. And then you do the lower third around the hips and down to the feet. And you trace that 3 times. And then just one more big heart over the whole body. And I don't always have time to do all 3 sections of my body. So I do this a real lot. And I can just feel it go right through my whole body now. It lights up that whole circuit just because I do it so much. And this is very simple to do. And you can do it anywhere. And nobody's going to say, what are you doing? What's wrong? Like look at you like you're doing something weird. And you can do it anywhere. So that's really about the book. And those are the things that I find that really help people the most in a very short amount of time. And gives them a quick, easy tool, because you can't give someone a whole bunch of stuff to do to make lifestyle changes. It has to be baby steps. So this is a baby step book that I've just gotten really good results with and sharing. And I've shared this exact same information for years, but I always had to keep making more copies. But now it's laminated, so I don't have. You can use it and take it to the beach with you, and it won't be harmed.
Well, I like the size, and I like the fact that it's laminated. And I just want to add a comment about Triple Warmer, because one of the things that people forget, and you mentioned it when you were talking, is that Triple Warmer was only designed to do two things, and that is to help us take flight or fight. It was never designed to help us think. So when people come up here to those oh my God points, as Donna calls them, it brings blood back into the forebrain so they can think what to do next. What do I need to do?
Exactly, because if you don't have that blood in the brain, you're just going to continue spiraling in your circle of stress. And all of us, we've all experienced it. We all know that that's what happens, is you get caught up in it and you don't even know where you're headed. Another way to help Triple Warmer calm and to Triple Warmer, now a lot of people may know this, the Triple Warmer was actually a radiant circuit in utero when we were being developed, and then right after we're born, Triple Warmer is a radiant circuit for a number of months. Until the need for fight and flight comes in, he stays a radiant circuit to give us that joy and that peace and harmony. But so once the stress begins, then Triple Warmer flips over into that fight protector. We want him to be the radiant circuit because he still protects us like that, but he doesn't quite know how to always stay there. So I'm going to show you a real quick way to also make Triple Warmer a radiant circuit, and I will credit Laurel Camden for this, as she developed this protocol. It's very, very simple, and it's a lot of fun. You get a nice crystal, okay? I need a big one right now just so you can see it better, but you don't need big ones. I have a little tiny little Herkimer quartz on, that work just as well. And you take your crystal and you hold it to the temple and you twirl it. I'm twirling it back and forth in my fingers. You see, just back and forth, and it's going around. And so I'm twirling it from my temple and I'm tracing around the back of my ear to the bottom of my ear. And I'm going to do that 3 times. And I feel the shifts. It feels so good. You can just feel stress levels just coming down 3 times. And then you do the other side. And this is just a real fun thing. If you like working with crystals, just a clear crystal. That's all you need. And it can be any shape. And just put it on a string so you can twirl it back and forth. And that just brings it down a lot. And Triple Warmer then starts glowing like a beautiful radiant circuit should. So simple.
I'm so glad you showed that, because I saw Laurel Camden do that on one of the conferences, and I did that for a while and I kind of forgot about it. So I'm glad to see it again. And I have a question from Diane. She wants to know, how do you strengthen gallbladder? What is your suggestion for that?
Okay. There's many ways to strengthen things, and I always go with the easiest first. And the first thing I would do is flush it. So you trace gallbladder backwards 1 time and forward 3 times. And that's going to remove the negative blocks that are there, and it's going to strengthen it. And you can continue to trace it forward a few more times if you want to. That works very, very easily. And then the other thing is you can hold sedating and strengthening points, the acupressure points, which I always keep this cute little book in my pocket. I'm never without it. I have about 6 of these. And it's all the acupressure points for strengthening or relaxing a meridian. So you could go to your little source on the gallbladder and hold the actual acupressure points and strengthen it that way. That's another really easy way. It just takes a little longer than it does to flush it. You can also take your crystal and you can trace the meridian with the crystal and go over the body in that pathway of the meridian, and that will strengthen it and remove blockages also.
So Gail, that little book that you just showed, where did you get that?
Oh, okay. So this is from my friend Sherry Ramirez, and she lives in Las Vegas. She's an energy medicine practitioner. She went through the program and is an advanced practitioner. And her greatest talent, she's got many talents, but one is to make educational materials for us to use as helpful aids. And her program is Healing Hands. Energy Retreat is the name of her company, and she's made a number of books, all of Donna Eden's energy medicine tips. So this is all the strengthening points, and she's very, very specific and accurate to the exact point of where things are at with all of her acupressure points and sedating points and all that. And she even has books that go through year 1, year 2 of the CP program to give you a little helpful guide so you can use it with your clients. And I always use this and introduce my students to this as well, because I don't need to remember all these dots, okay? And the ones I use all the time I remember, but then when I want to strengthen or sedate, let's just say a large intestine or something that maybe I don't use that a whole lot, I just go to my little book, pull it out, and I keep one in my purse because they're laminated cards too, kind of. It holds up to the stress of me beating things around in my purse. I throw one in my backpack when I go to work, and I have one on my table here. So I've got them everywhere. I have one in my suitcase. I just don't take them out. I keep them there because I travel a lot, and I never leave home without it.
I love the size. Perfect. So
It is.
easy to put anywhere. Yes.
Yeah. Pocket, hand, purse, wherever.
Yeah. So just going back to the PowerPoint, Gail, can you talk about the difference between the PowerPoint and the electric points? Because they're so closely connected there, but they each have different special talents, you might say.
Yes, they do. The PowerPoint, which is in the back of the head, right in the center, right where the skull meets the neck area. This point is just what it is, PowerPoint. It is one of the most powerful points on the whole body. It connects directly into the brain, and it goes through the nervous system. It connects to every single system in the body, and every meridian, every chakra, any energy system, any point on the body, this PowerPoint will connect to. And it sends energy right to that spot. So if you hold your middle finger on this PowerPoint, and then you just take your other hand and let's just say, let's just put it on your heart. Lay your hand on your heart, and you're taking the energy from the PowerPoint and you're putting it directly into the heart, and you're energizing your whole heart chakra with the energy of the PowerPoint, and it's going through the aura and sending information through the Celtic weave, through the grid, through all energy systems to nourish and to power and to strengthen. Very powerful. I can't say it any other way. It's just very powerful. You can take this PowerPoint and you can connect it to light up all of your radiant circuits and do hookups with it. So you can keep your hand in that spot back here, and then you can hook up to your third eye with the PowerPoint. And this is very powerful. Now you're connecting the third eye, the sixth chakra, but you're also sending information directly through your brain because you're coming right through the front and the back of the brain. Very, very powerful. This also will calm triple warmer. It dumps stress. It lets you think better. It puts everything in a different perspective. And pain goes away even with this. I've noticed that people don't have as much pain when they've got generalized pain or pain anywhere. Then you can take your hand that's on your forehead and you can put it onto the top of K27 here on either side of the chest bone and between the ribs and hook there. This is hooking up your radiant circuits. Okay, so you can connect there. And that really is really powerful because the kidney meridian is so strong. It goes to every single organ in the body. Once it leaves these little points and dives into the body, it connects everywhere. So you are now taking very powerful energy from your power point, from your brain, and into the kidney meridian, which is going to every organ in your body. Every cell is touched by this. You can take it and you can hook up the end of the spleen meridian with the power point and nourish your spleen and your immune system. You can hook this to anything and deliver really powerful energy and light up the radiant circuits. Spleen is also a radiant circuit, so you can make this a radiant circuit by doing this as well. And then you can switch and do the other side, which really is so simple to do. Mm-hmm. The only time I advise not doing this is while you're driving.
Right.
Yeah, that's the only time you should do it. So this has been because I can really feel a big change.
Yeah.
Of energy going through there.
Yeah.
And then you can also hook up the power point and the navel to hook up your governing and your central meridian. That's another thing. I mean, everything we do in energy medicine has like 9 beautiful benefits. And not only is the power point very powerful, but it also sits on the governing meridian, which is very powerful too. And so now we're connecting the power point with the central meridian. We're connecting the governing meridian in the back with the central meridian. And the navel is also a very powerful place, and that's where the aura enters into the body and brings information in. So we're connecting into some really powerful spots. And then the radiant circuits light up. I can tell my face is getting flushed.
Yes.
Lighting up.
Right.
Yeah. And so that's the PowerPoint, and it can be used anywhere in many, many ways. Connect it to anything and you'll have positive results. The electric points are in the back of the head, right behind the ears. On the bony processes, there's a little dent back in here. You can feel it on your own head. And that's called the electric points. And there'll probably be a little tender feeling too.
Mm-hmm. Right.
My anatomy's a little off on this girl. Here's her electric point right there on this green dot. And so the electric points are connected to the electrical system, which includes the heart, but it also goes to every single cell in the entire body. And they're very, very powerful in that they have their own healing capacity all on their own. And you can't tell them what to do. You just stimulate the electrical system, the electric points, and the energy just goes where it's needed. Wherever in the body it's supposed to be, it will go and it will heal. And it's very powerful. These are wonderful points that if you're a practitioner, you want to work these on every client when they're on the table, at least for 3 minutes, to stimulate them and to get that electrical energy going through. It lights up radiant circuits. It connects to the grid. It goes to every system. It feeds the chakras. It feeds the heart. The meridians get charged from this. Every system. Triple warmer calms with this. So work those, but about 3 minutes routinely. Anything like 5 minutes and longer, then you're going to be really hooking into the really deep, deep energy of the electric system. And this is very deep work. And once you hook into it, you can't just like let go, because then you're going to really put somebody into a triple warmer reaction. You have to hold it until the electrical system is done doing its work, which could be a half hour to 45 minutes to an hour or longer, depending on the work that has to be done for the person. So we have revitalizing the electrics protocol. We have an actual deep electric revitalizing protocol too. So when you do your regular energy work, stimulating these areas for about 3 minutes and holding them is going to really give everybody an extra boost. If they need the intense session, then you want to get out your protocols and go through the whole protocol so that you do that safely for someone so you don't interrupt the process.
Mm-hmm. Great. Gail, one other thing I just want to remind people, since we've done so much speaking about triple warmer, is that there are only 2 things that will bypass triple warmer, and that is rocking and tapping. And one of the reasons is because primitive man rocked his body and tapped his body. So when we look at EFT and a temporal tap that Donna uses, they have been so successful in helping to, again, change a belief system, change habits, bypass that triple warmer reaction. That I think it's important for everyone to learn those easy protocols, especially Donna's temporal tap.
That's so true. And the body will always accept those two modalities and not have a reaction to it. It likes to be tapped and it likes to be rocked. And it goes back to, if you look at babies and how they rock themselves all the time, and they hold themselves and they rock back and forth or forward and back. And that is very calming and soothing. And then the tapping, it's so simple. You can just tap your temple area, and you can just trace around the back of your ear, and you can just do that a few times. And that sends a really beautiful message of peace and calm, and allows triple warmer to know that he's in a safe place. And you do that to both sides. Another variation is to hold your heart while you do this, because then you are also connecting to the love and the energies of the heart while you're tapping. Mm-hmm. You can interrupt panic attacks and stop anxiety episodes by tapping, especially around here. And then on the gamut point too, right here on the hand, this is the triple warmer meridian. And so you tap there 10 times and you wait 10 seconds, and then you tap for another minute and a half while you're holding your heart. I don't know if you can see me do this, but hand on the heart, and you tap. So you're connecting to the heart chakra while you're tapping triple warmer. And so you're just infusing triple warmer with all that relaxing love. And panic attacks will just stop with this, and worry. And you do both hands. And if you can't get your hand to your heart, you don't even have to do that. You can just tap anywhere, and you're still going to have positive effects by tapping that meridian like that. And he likes it. Triple warmer likes that.
Yeah. So if you're in a meeting and you're having a little anxiety, you can just very calmly go down and massage that area that we were just tapping and relax that triple warmer very, very easily.
Place your hand on your leg and your lap and just tap it with the other hand. It's very simple to do. Yeah.
So I have a question, both from Diane and Deb Gallagher, and they want to know if you sell that little stress book and if they will get the information on how to order it. So I want you to know that, yes, all of that information will be with the replay link. I will be sending a copy, a PDF of the actual PowerPoint that I showed, and that has all the information on how to get the book from Gail. And I'll also include information on Sherry and how to get in touch with her for the acupressure point book that Gail showed us.
Good.
So Gail, I know that you're going to be a keynote speaker. I just talked to someone today. They're very excited because you're going to do, is it a pain management conference?
Yes.
You'll be the keynote speaker.
Keynote speaker. I'm moving up in the world here. I'm really excited about it. Yeah. I will be speaking at the Pain Management Nurses Association in St. Louis for their regional chapter meeting, their annual seminar that they have. And that'll be on April 30th at DePaul Health Centers, where I'll be at. And I spoke last year at the American Holistic Nurses Association and gave a half-a-day seminar on energy medicine and touched on a lot of different things about health. And there was folks there that were responsible for putting this together, and they asked me right away if I would be their keynote speaker to bring information forward. And so I have many, many, many seminars I've done on pain management, because that is another huge chronic illness that we have to deal with. And almost everyone has some kind of complaints of pain when you see them.
Right.
So I've developed many programs for helping people deal with the pain and trying to put it in simple ways so that they can use it themselves, and I can teach the nurses or the caregivers how to do these things also to help their loved ones or their patients to be relieved of their pain that they're in. So I'll be presenting predominantly on energetic, integrative, holistic ways of pain management, and I'm real excited about that.
That sounds like a great way to keep spreading the information. I have another question because Carol is asking, how did you get energy medicine in the Mayo Clinic? And you talked a little bit about that in the beginning. Maybe you could go over that again for the people listening.
Okay, so I didn't just I've worked there at Mayo Clinic for 9 years now. And I was beginning my official training into the energies and healing, transforming from nurse to nurse healer is the way I kind of look at it. That was my journey. And I didn't just come right out and say, okay, you got to do this because it works and I like this and I've seen people heal from this, and bring it into a medical area. You have to work your way in. You have to know your research, and believe me, I've done that. And you have to present things in scientific ways because you're dealing with a scientific community, and they know science, but they don't know what the alternative integrative part of that is, because we don't have as many experiments and double-blind studies and now these triple research programs to validate the use of something. So it's a different paradigm of looking at healing. So you connect with people who have like minds. And when you do, then you start sharing what you know and teaching them. And you go out of your way to teach them and bring information into them. And you start just integrating it. And the beautiful thing about being a nurse is nurses have done this for all existence of time. You just do what you're supposed to do. You don't always ask for permission. You just do it, because when it's right for the patient, that's what's right to do. So you work with the patient, and the patient says, oh my gosh, I've never felt so good. Well, good, then you teach them how to do it. And the next one that comes along, you say, well, would you like to do some integrative work? Well, yes, I would. Well, then you have permission to do that. So you work with the patient at their level, and it just starts to spread about. Then you start writing articles about it. Then you start giving presentations about it, and you're going to different meetings. And I can't tell you how many presentations that I've given at Mayo Clinic on energy and holistic and integrative healing to get that word out, as well as many, many other nurses have done the same thing. So there's a lot of us working towards this goal. And about 2 years ago, I was asked to write a paper of what energy medicine was for a patient of Mayo Clinic, and they took it and they published it, and it's actually official now that energy medicine is part of things that they offer at Mayo Clinic.
Oh, great.
Unfortunately, I'm the only one certified at this time to do it. So, the resources don't go as far as they should. But they have accepted that. They use Reiki, and they use massage therapy, and they use Qigong and Tai Chi and yoga and massage and acupressure, and they have acupuncture. So their holistic integrative department is really becoming very, very large. And I'm happy to know that they're integrating all areas of holistic healing, for that person who may not, want energy medicine, but where they sure like Reiki. So we have all of that available now.
Well, and in all honesty, Reiki and healing touch, Eden energy medicine, they're all energy medicine. It's all based on energy.
And that's true, Elsie. You can't separate it out. It's all the same. They're all 5,000 years old. They're and if you study one field and you look at another, you'll see that there's so much similarities.
Yes.
Tai Chi, I took a Tai Chi class a few years ago, and I'm like, well, this is exactly what we do in energy medicine. Yoga, the same thing. You're stretching meridians, you're opening up, making space, allowing that energy to flow through. You're breathing in the good energy and the light, and you're transmitting it into you. So it's all the same. One is not better than the other. It's what is it that you like? We all have our little niches of what's fun for us to use and makes us feel really good. But all of it is good. It's all energy, and it's all God-given, and none of it is wrong.
And it's all based on the heart and, care and compassion. So how can you miss with love and the heart? I mean, it's when it's coming from that place, it's not about the technique. Yes, we need the structure. This is the way that we can do something. Americans need that structure. But again, as you pointed out, this is 5,000 years old, and our traditional system is only really a couple hundred years old.
Yes, that's right. And before our traditional system came along, we were doing integrative, holistic energy work on one another. And I'm going to talk about my bias right now. The pharmaceutical companies came along, and they've done a lot of good for a lot of people. But it changed the way we practice medicine and the way we heal people. And we began to now then practice medicine instead of healing one another. Because medicine doesn't do the healing that we do with one another. So that changed our whole approach to healthcare. It's been medicalized. I'm really proud to say that it's shifting, and there's more and more going back to becoming the healer. And I put this out there to everyone. When does the doctor become the doctor healer? When does the nurse become the nurse healer? When does the person become the healer? Instead of just focusing on small portions, but healing encompasses everything. It's and you don't direct where the healing takes place. That healing comes from a spiritual avenue, and you don't ask spirit what to do or tell spirit what to do. You graciously accept what spirit gives you, and you share that through your heart, through your hands, through your passion, through your love, and that's how we become that healer.
Well, that is so important today, because the fastest growing population right now are people over 100. We are living so much longer, and people want to live well. And as you said, our biggest issue is chronic illness. So all of the tools that we're bringing back can help us with chronic illness.
That's the most wonderful thing, is you can eradicate many chronic illness symptoms with doing energy work and opening up those pathways, and you can heal, literally heal. I was just listening to a teleconference yesterday by Jean Houston, and she told a story about her husband who was 70 years old, and he started working with the energies in a way that he put the intention out. He wanted to look like he was 45 again, and within a number of months, he was looking like he was 45 and feeling like he was 45, and he was 70, and that's remarkable. And myself, I mean, I'm now a senior, and most people don't think that I'm the age that I am. And that's the energy that keeps the body healthy. And in a younger way, I'm not striving to become a young person, but I do want to stay healthy and not be succumbing to arthritic problems and with vision problems and, circulatory issues. And my brain, I want it to stay healthy. I don't want to, pick up energy that's going to make my brain not work. I have Alzheimer's in my family, and I'm determined that I'm not going there. So I keep doing the energy work, bringing through the good energy. Donna said something to me one time. We were doing the exercise of freeing the diaphragm, and where you bring in extra oxygen to the body and you force it to go through the body. And she said, Gail, if there's oxygen, there can't be disease. And I'm like, well, that makes perfect sense at all levels. So my nurse said, yes, in my brain, that's right, because things are healthy when there's oxygen there, because then there's nutrients and there's positive things and the cells can survive. And I was showing this to a couple of people just yesterday in my nursing class, and I said, this is your own little hyperbaric chamber. You don't have to go deep sea diving to get into a hyperbaric chamber to oxygenate your body. You do that, freeing the diaphragm, and you infuse your whole body with oxygen and increase tissue healing. So we are our own hyperbaric chamber. We don't need to go into that little room and get that.
Oh, I never thought of it that way. That's fantastic. And we all know that oxygen is the key to keeping cancer at bay and many other illnesses or chronic situations. So, Gail, we're running out of time, but is there any words of wisdom you would like to leave us with? I think we got, yeah.
We got froze up there for a moment, Elsie.
Yeah, we did. Just, yes, I realized that. And I have one question from Deb Gallagher. Deb Gallagher said that as an RN herself, I feel so inspired to hear your story. I too am involved in my local chapter of holistic nurses and have given one talk so far. So keep going, Deb.
Absolutely. Keep going. Never give up. Just keep going and sharing that knowledge, share the energy, and spread the word. And it's one person at a time, and it's a process and it's a journey.
Yeah.
But it's worth it.
Well, thank you so much for sharing your journey and so much valuable information tonight. And I will be putting this into a YouTube, sending out a replay a little bit later this evening. So if you have any problems downloading or any questions, you'll have information on the replays to how to get in touch with Gail or myself. And we so enjoyed sharing time with you.
Elsie, it's been my pleasure. I really love sharing this information with people and getting new things out to them that they can just use easily to make big dramatic changes in their life, you know, one baby step at a time, and it's wonderful. So thank you for the opportunity.
Oh, thank you. And I'm sure we'll be getting your book.
Okay.
Your little stress book. Okay, good night, everybody. Thanks for joining us.